Hello, my name is Andrea. In today's class, we're going to learn about how to continue your medical career and practice internationally. This lesson is divided into three parts. In part one, we'll see what types of registration there are. In part two, we'll learn about the PLAB. Finally, in part three, we'll extend the information about PLAB stations and advice. Let's get started. Let's start with part one, types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council, GMC. There are several types of registration. Provisional registration is for doctors who have just qualified for medical school in the UK or from certain European Economic Area (EEA) member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have completed equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training to have a certificate of completion of training, CCT. The GP register is a register of all those eligible to work in general practice in the NHS. Now for part two, PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessments Board (PLAB) test. The PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in a UK hospital. The test consists of two parts. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios, known as stations, to assess professional skills. Moving on to Part 3, PLAB stations and advice. The OSCEs assess these skills. Clinical examination. Your ability to carry out a physical examination of a simulated patient, an actor trained to play this role, will be assessed. Uncomfortable or intimate examinations will be carried out using a mannequin, an anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient, or in some cases the examiner, will be assessed. Skills tested may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make reasoned diagnoses will be assessed. How can one be better prepared for these exams? Here's some advice on the stations from a successful candidate. Read the instructions outside each station carefully. Don't forget the ABC, airways, breathing, circulation, protocol, every emergency situation. Keep in mind safety precautions like throwing the sharps in the sharps bin. Check the patient understands what is happening. Then ask them about any concerns they may have. Note: sharps are needles and blades which must be disposed of safely in a special container called a sharps bin. That's all for today's lesson. I hope you enjoyed this class and you can apply it well to your medical practice. Best of luck. See you in the next lesson.